Hello, dear student. This is the humerus bone, and humerus bone is the bone of the upper limb. It lies in the arm region. We have two humerus bone, one in the right side and the left side. This bone takes place vertically, and when we talk about a long bone, it has three parts. This is the upper end. Up to this much, we will consider it as an upper end. The tapered portion will be the lower end, and the long part, which is an elongated cylindrical shape, is the shaft of the bone. So when we come to the side determination of the bone, we have to keep three things in mind. This is the head. The head always will take inward and upward. So if I hold the bone in an anatomical position, it takes in and outward. This is a greater trochanter, which will be outside, that is laterally, and the lesser trochanter will be facing us anteriorly. So the upper end will be a circular shape in structure. If you compare the lower end, it will be taper. So the lower end, in the posterior, we will get a foramen. This is called as the olecranon fossa, and then we get two important fosses here. One is the radial, another one is the coronoid. So this is how you can demark. The medial epicondyle will be just as clear and straight towards the head. So if you hold the bone, you have to hold it as per the anatomy. If it is the right side, you have to hold it in the right hand. If it is the left side, you have to hold in the left side. So coming to the parts of the bone, if we take the upper end, it has a head. This is the articulating part. It joins with the glenoid cavity of the scapula to form the glenohumeral joint, or it is called as shoulder joint. So the movements of this area will be flexion, extension, abduction, adduction, rotation, circumduction, almost all the possible movements, because this is a type of a ball and socket joint. Now when we come next from the head, we get a constricted part. This is the neck. Our humerus bone has three necks. One neck is called as anatomical neck because it takes by the position, anatomical position. What is the purpose of the anatomical neck? It is separating the head from the upper end. Next we come to here, we have another neck which is called as surgical neck. It is used during the surgical operations, and also that's separating the upper end from the shaft. So surgical neck separates the upper end from the shaft. Anatomical neck separates the head from the upper end, and above the surgical neck, just 0.5 centimeter above, we have another neck which is called as a morphological neck. Okay, so this is the view which I'm showing you here, is the anterior view of the humerus. Next, laterally we get the greater tuberosity, and this is the later tuberosity. So greater means it is size is great, and lesser means it is less. Tuberosity means the elevations in a bone. So if you see the bone, you can see some elevated parts, and these are called as a tuberosity for the upper limb. Next, we get in between the two tuberosity, we got a canal, and this is called as an intertubercle sulcus, or it is called as bicep groove, because through this the bicipital arteries, nerves, veins, all will be passing through this area. So this is the bicipital groove. Now coming to the shaft is going to have three borders and three surfaces. Borders are the sharp margins of the bone, and the surfaces are the flat. So if you take the bone, we will get first border, which will be from the lacer we will be putting down like this. We get this border. This is called as an anterior border. Next, from the head, if you come down, you will get another border. This is called as the medial border. And when you take the greater tuberosity, you come down, you will get a lateral border. So please keep in mind, for humerus, we don't have any posterior border. Now, when we are separating the an anterior border with the medial border, we get a surface. So this surface is called as anterior medial surface. Take clockwise or anti-clockwise direction when you are demonstrating any kind of the bone. Now, this is the posterior part. So this is what? This is my medial border, and this is the lateral border. If you got a surface, this is called as the what surface? This is our posterior surface, because this is the posterior part I have mentioned. This is the posterior view of the humerus. Now we will make a turn again. This is the greater tuberosity, and this is a lesser tuberosity. Again, we are getting a surface. It is clear to you, a smooth part. So this is called as the anterolateral surface. Now let's remind, we have three bones. From lesser tuberosity, if you draw a line, we get an anterior border. From the head, if you draw a line, we get a medial border. From the greater tuberous, we will get a line that is called as a lateral border. So three borders: anterior, medial, and lateral. We get a surface. Anterior and medial, we get the anterior medial surface. Medial and lateral, we get the posterior surface. And from the lateral to the anterior border, we get a surface which is called as the anterior lateral surface. Along this thing, we can also get some lines that is called, we get a tubosity which is called as deltoid tubosity, and we get a line which is called as a spiral line of the bone. If we see the bone clearly, we will get small foramens through which the bone gets nourished inside, and this is called as a nutrition foramen of the bone. This all things we will get in the shaft region. Now coming to the lower end, the lower end is the taper part. This is the anterior part of the bone and this is the posterior. So anterior part we get two fossas. Before the fossas, let's look on. We have a head, a cap like structure which is called as a capitulum, and a trochlea, pulley like structure known as a trochlea. So the capitulum will be getting attached to the radius bone, and you can keep it coding with a famous team of our IPL. We have RCB. So R for the radius, C for the capitulum, and P for the bone. Next we have the trochlea, where we will get attached to the ulna. So you can keep it union territory. As an Indian, we know the union territories. So U for the ulna, T for the trochlea. Now when we come to the bone, we have some epicondyles. So this is called as the medial epicondyle, and this will be the lateral epicondyle. Above the epicondyles, we get some free spaces called as ridge. So this will be supracondylar ridge. Above the condyle, supracondylar ridge. So this is medial supracondylar ridge. This is lateral supracondylar ridge. Above them, we see some small dents. These are called as the fossas. So we have above the capitulum, we have the radial fossa because radius is touching here. This is the articulating part of the bone. Capitulum, trochlea, they are the articulating part of the bone, like as head. Next, we have the coronoid fossa. It is just above the trochlea. Next, in the posterior side, the demarcation of the bone will be, there is a largest fossa, and this is called as the olecranon fossa. So this is all about the humerus bone. Now in the lower end we have also two joints. We have one is called as a radiocapitular joint, another one is called as ulnar trochlear joint. So we can also call it as a radiohumeral and ulnohumeral, and together this two joints form another complex joint. Complex matlab kya hai? More than one. And this complex joint is called as an elbow joint. It's a type of a hinge joint, and you will have view only in two movements. One is the flexion, another one is the extension of the bone. So till then, stay tuned with us. So this is the humerus bone. It has three parts, upper and shaft and lower end.